Hi, this is Dan Limmer. I'm a co-founder and chief Pass-ologist at Limmer Creative. Our singular purpose is to help you pass the test. To that end, this is our second video in a series we have called Digesting a Test Question. Now, many people are taking the NREMT EMT exam, but this could be your state exam or maybe even a classroom exam. I think it would help you. The question you see on the screen is probably one sentence longer than you'd get on the NREMT, and I've put a little bit more information in here than you might normally see, but I did that so I could call out some of the things that I want you to look for. So let's read the question and we'll go through it. You're treating a patient who complains of respiratory distress. He is breathing rapidly but shallowly and can speak 1 to 2 word sentences. His skin color is poor. He appears tired. His family states he has bad chronic bronchitis and congestive heart failure. You should. Now, at this point, if you're sitting in the exam center, I don't even want you to look at the choices yet. I want you to figure out what this question tells you and, in fact, what this question is asking. So, he has respiratory distress. Right, that's good. Now, that could go in a lot of directions. Let's read on and see where the real meat of this question is. He is breathing rapidly but shallowly, and he can speak only 1 to 2 word sentences. His skin color is poor, and he appears tired. Now, many questions aren't going to give you all those clues, but I want you to take a moment and picture that patient. Right? This patient is sick. This patient, if he's not in respiratory failure this second, he will be the next second. He's that bad. All right? And this question paints a picture of that very, very well. Rapid, shallow breathing, 1 to 2 word sentences, poor skin color, and tired. Let's break those down. Rapid and shallow breathing may not be adequate. That in itself, just the word shallow or the word rapid in a test question may indicate respiratory failure or developing respiratory failure. Remember that for breathing to be adequate, that means adequate to support life. It must have an adequate rate and an adequate depth. Now, the adequate rate is in a rate in that middle of that crazy thing we call normal. But really, really fast and really, really slow mean the patient probably needs to be ventilated. In this case, I put the word shallow in here as well. That's the other word you got to look for. If someone's breathing shallowly, we may have to ventilate them. And 1 to 2 word sentences, that's pretty fast. I think I can tell you and that's it. They can only bring enough breath in and get enough breath out to put 1 or 2 words out, right? And that's bad. Now, what really puts icing on this is that his skin color is poor. Okay, and you see that pale skin color. It might be moist, and he appears tired. Why is he tired? Because the work of breathing, using all those muscles for respiration, makes you very, very tired. You can't keep that up for a long period of time. So these are probably some of the biggest clues that you'll see. And again, I put them all in one place. You won't get one handed to you like this. You might see 1 or 2 of these, but it builds a patient picture of a patient who needs to be ventilated. Now, the 2 other things that are in here I want you to just note is that the complaint is respiratory distress. That's not a surprise. And then he has a history, all right, of respiratory problems, bad chronic bronchitis and congestive heart failure. Okay, he's got a long history of respiratory problems. He's a respiratory train wreck. But just the history of respiratory distress and the type of diseases he has doesn't indicate he needs to be ventilated. It's part of the picture. Now, some people will say, well, gee, he complains of this, so he must be okay. Well, he might be complaining, and those are going to be his last words. If you look at the fact that he complains of respiratory distress and you ignore the parts of this question in the middle that really tell you what needs to be done, then you will get it wrong. The center, shallow breathing, 1 to 2 word sentences, poor skin color, and tired, that should tell you that he needs to be ventilated. Now, let's look at the choices. Because if you read this quickly, and I think that's one of the big mistakes people make, is they read through the question so they can get to the choices. Read the question thoroughly. You have the time. Go through and figure it out. So now we pretty much figured out what this question's about. So now let's look at the choices. Nasal cannula? No way. Venturi mask? No way. Non-rebreather? Well, that's the big guns, but it still doesn't push air into the lungs. And what do we need? We need to ventilate him, and we knew that with the bag valve mask, and D is our correct answer. If you saw our first digesting a test question video, sometimes the questions ask something that you're not aware of. And this one was about, the first one was about interpreting a question. This digesting a test question video is about looking for clues within the question that give you the answer that you need. Now let's use a shock scenario just to wrap this up. What things indicate criticality in a medical or a trauma shock patient? Okay, well, rapid pulse and respirations, an altered mental status, and you may also see a narrowed pulse pressure when the systolic and the diastolic seem to be getting closer together, or they are closer together. That's one of those hidden clues you need to know. So every question, if you read it well, and that is so important, I think it's one of the biggest mistakes people make, if you read it well, get all the facts and figure it out, it will lead to success on the questions, and then therefore all the questions, and therefore the exam. My name is Dan Limmer from Limmer Creative. I hope that you enjoyed this video. We do exam prep apps. They're available on the iTunes Store, they're available in the Google Play Market, and also at our website, lc-ready.com.